new and improved, better than ever. We hear this all the time. But with the many advances made in technology, it's often actually very true. And that's truly the case when it comes to tried and true new dental techniques. Dentist Steve Marsh is here with ways technology is helping take care of your teeth. So welcome back, Steve, to the show.
Thanks, Lori. Thank you.
Now, we know you've just recently celebrated 40 years in dentistry, so you had to have seen a lot of changes, particularly in technology.
And recently we've talked about materials, but technology has really changed things. So today, the state-of-the-art office has mostly digital things, whether it's impressions or x-rays and that sort of thing. So I thought we'd sort of take a mini tour of my office with lots of photos to show you what we're doing to make dentistry easier, better, and actually more accurate.
Okay, all right. So here we go with some of the pictures.
So when we have a new patient, and even our existing patients, this is an imaging room within our office, and we bring the patients in, especially on a new patient. They have different needs and different wants, just like you might do with a new client. It's sort of our due diligence. So we take images inside the mouth, on the outside, and I ask them, what bothers you? Is it the smile? Sometimes not the smile at all. Maybe they've broken a tooth. Another fascinating thing is digital x-rays. Now, in the old days, we had these little x-rays. Environmentally, they also weren't too great because it's plastic and there was also develop and fix. This is Debbie in my office showing a patient an issue that the patient's having. You can see we've enlarged it. So it helps us in terms of diagnosis. We become more accurate. And we're also able to show the patient. You know, sometimes, Lori, a patient may say, gee, I'm not having a problem. The dentist says, you know, there is a problem. This is, again, Debbie pointing to the image on a flat screen TV that we have in all our operatories, treatment rooms. Sometimes we watch TV and sometimes we use it to identify the problem. This is a patient who had a cracked tooth, not having any pain. This was Debbie able to show the patient, and now we say a picture's worth 1,000 words. It actually is. And this is the latest thing in cavity detection. It's called a caries view. So you know we talked about x-rays. A caries view, and Amy, our hygienist, is holding it into the patient's mouth. She takes a photograph with this caries view, and it has a very bright light. There's no radiation. It shows up digitally on the screen. That's a picture that Amy had taken of that patient. You can see an old silver filling, and you can see some cracks developing. So again, it makes us a much better diagnostic team, and then we can also point out to the patient, here's an area of concern. Doesn't mean we always have to fix it, but it gives us an idea of what we have. We store the images, and if you come back in a few months saying it hurts, we have a way to identify
Figure out what's going on, yeah.
Lastly, in decay detection, the diagnodent. This has numbers on it, goes from 0 to 100. So when a patient starts to have a tooth that's breaking down, we are able to put a laser tip on the tooth. It measures the density of the tooth, again, at reading 0 to 100, and it tells us how dense it is. So sometimes a dentist may say, gee, there's an issue here. You don't have a problem. There may be some stain. And you can't tell as a dentist sometimes whether it's stain or decay. The diagnodent gives us a very accurate diagnostic ability.
Wow. And how about that goop that always had to go in your mouth to get impressions? That was just awful.
So we're pretty much done with the goop. This is Tracy in our office. We have a digital scanner. You know, when we went from photos to analog to digital, we said, is it going to be better or worse? It turns out to be much better. Same thing here. So instead of putting the goop in, this is a patient. We have our patients wear these glasses to protect their eyes from debris, whether we're doing an image or not. And she's going through the mouth, and within a minute or two, she can take a whole image. This is the back of my head as I'm looking at the image on the screen. This is the image that we use when we take impressions. From there, we then push a button, it goes over the internet, and the laboratory will print a 3D model. Not pouring it up. And this is an example of a 3D model. It's light, it's accurate, and this is what we're able to use instead of the old ones. Very light, very accurate, and then the crown or veneer can be made on this. There's no expansion or contraction of materials like you have when you pour up cement. So we find that placing the crown may take a couple minutes, not so much where the dentist is adjusting height, because they're literally that much more accurate.
Wow. I wish we had more time to talk about more things, but because technology is going to keep changing. You're going to have to come back and tell us more.
And what I do want to make, it makes it easier for the patient. It makes us better diagnosticians so we can be more accurate and make the whole experience that much more pleasant for our patients.
Which is always a good thing. The techie tools and techniques aren't just clever and cool, they're also incredible advancements in dental diagnosis and patient care. To put them to use for you, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.